Bed bath. Bed bath is a procedure given for those patients who are confined to the bed and those patients who are physically and mentally unable to do the self-care by themselves, and it is a bath which is given on the bed itself. The purpose for giving the bed bath, first is to clean the skin of the patient, to stimulate the circulation, to induce sleep, to promote health, to assess the pressure source, and to feel a sense of well-being. Next is the articles what is required for the bed bath. First of all, we require a tray which contains of bath blanket to cover the patient. Next, we require a long towel to clean the patients as well as to support the patients. We require a face towel, that is to wipe the face. We require a dress for patient to change when it is soiled or after the procedure. We require a basin to mix the water and a mug to transfer the water. Then we require 2 jugs, one is hot water and one is cold water, and the water should be the patient's preference, that how much the patient wants the comfort. Next, we require the bucket. The bucket is to transfer the dirty water, and this bucket should be put it into the stool. Next, we require a tray. In this, we require a bowl which contains of 2 sponge cloth. One is for the soap and another one is for the water to clean out. Then we require a bowl, that is a comb to comb the patient, a nail cutter to cut the nails if it is required, nail brush to clean the areas, kidney tray and a paper bag to collect the waste, a pair of gloves, soap with a soap dish, and a bath thermometer, that is to measure the temperature of the water. Usually the temperature is 105 to 110 degree Fahrenheit. Then next, another tray we require. This is for the back care, that is a spirit to apply on the skin, a powder to apply on the skin, oil, that is also to apply on the skin, then 2 sponge cloth. It is mandatory. If it is done here, then we do not need to prepare. Then this is a bowl which contains a gauze for the cleaning of the perineum after the procedure. This is a bedpan with a cover if in case patient requires to go for the washroom, and this should be provided before the procedure. This is a laundry bag to collect the soiled clothing, and this has to go for washing. General instructions to be kept in mind as well as preparations of the patient unit. First of all, we need to maintain the privacy of the patient, so we have to put on the screens. Then we need to explain the procedure to the patient, that why are we going to do the bed bath. Then next is we have to remove the extra pillows are there that needs to be removed. Then 1 pillow can be put under the patient if the patient's comfort is there. Next is we should not expose the patient unnecessarily. Next is we have to see that the cleaning of the area should be cleanest to the less clean area. Another thing is patient should be to the edge of the bedside, and we should stand at the right side of the patient, and we have to assemble all the articles prior we do the procedure. Special attention should be taken into the areas which are prone for the pressure sore. And another thing is we should make the patient's unit warm so that the patient will not go into drought. Another one, we should make sure that before the procedure the patient should go for the urinal or washroom if it is required. Another thing which you have to keep into mind is patient should not be given bath immediately after food. So we have to make sure that patient has not taken food immediately after giving the bath. The ideal time for giving the bath is before breakfast or 1 hour after having meal, otherwise there will be problem in the digestion. We have to remove the patient's clothing, and patient's should be covered with the bath blanket and the top bottom should be folded back. Then now we have to start the procedure, that is wash hands and wear the gloves. As we have washed our hands and wear the gloves, now we have to mix the hot water and the cold water. And we have to see by the back of the hand whether the water is not so hot, not so cold. Then next we have to take the towel and place it over the patient's abdomen, chest, and we should make sure that patient should not be exposed unnecessarily. Then this is the sponge cloth, we have to wear it, tuck it like this, then we need to wet it, then apply soap, then we have to start from the face. And whenever we are starting the procedure, all the procedures should be from the farthest arm, then it should come to the nearest arm. So we start with the first with the eyes, and for the eyes we have to start from the inner canthus to the outer canthus. So in one stroke we have to finish. Here also but we have to make sure that the soap does not go into the eyes of the patient. Then after that we have to, with the another one, we have to dip it and we need to clean it. Then take a soap, then take the start from the forehead, come to the cheeks, to the nose, then to the lower cheeks, then to the neck, then come to the clean the ear also. We have to take a soap, then we have to start from the forehead, then we have to come at the near to the eyes, to the cheeks, nose, then to the ear, then finish it to the neckline. Another one you take with this, which is a water one, which is with water, take it same way from the forehead to the cheeks, to the nose, to the ear, clean the inner ear, then finish it at the neckline. The same way for the other side also, take a soapy sponge from the forehead to the cheeks, to the ear, then finish it to the neck. This is with the water. Wipe it out the soapy from the head to the face, to the neck, upper lip, upper jaw, ear, then to the neck. Next we should come to the upper limbs, that is we have to go to the farthest arm, that is we have to take the hand, we have to expose only the area which is required. So for this, from the we have to start from the digital to the proximal. So in a long stroke you have to take one. This is a soapy. Then when you are coming to the axilla, this short hand should be above the head and we have to clean the underarm. We have to take the sponge with the plain water and we have to wipe out the soap, that is in a long and circular strokes from the distal to the proximal, and we have to clean the axilla. And after that, with the help of the towel which is down there, we need to clean the hand. Then if it is required, we can put a talcum powder under the axilla. Now what we have to do, we have to fold the towel, then we have to take this basin, we have to place it like this, then we have to dip the hand and we have to wash the distal areas, because these are the areas where there are chances for the accumulation of the dirt. Then if it is required, we have a nail brush and a nail cutter. With the help of the nail brush, we should clean the nail completely, and to those areas where our hands are not able to reach, in those areas you need to use the nail brush. Then with the help of the nail cutter, if it is required, we have to cut the nails. Then after this, we have to wipe it out with the towel. Then we have to cover the patient with the bath blanket. Next, for the nearest arm also the same procedure needs to be done, that is with the long stroke you have to clean the hand, and after finishing that we have to clean the digital, that is the hands, we need to clean it. Then for the chest, we have to place the long towel under the chest and the bath blanket should be folded below the umbilicus. We have to take the soapy gauze, then what we have to do, we have to slightly lift the edge of the towel and we have to give a strokes, and the stroke should be given in a, from the farthest arm to the nearest arm, in a longer stroke for the males, and for the females it should be in a circular stroke, and we should make sure that the underlying the breast and all that needs to be given a special attention, and make sure that the patient is not been unnecessarily exposed. Now we have to take the cloth, sponge cloth with the water, then wipe out the area which is a soapy one. Then completely we have to dry it with the towel, we need to dry it. Next is the second portion, that is for this we have to fold the bath blanket to the pubic regions, we have to fold, and the towel needs to be folded till the umbilicus. Then we have to take the sponge cloth, soapy sponge cloth, and we have to clean the area in a longitudinal and make sure that skin folds are there in the abdominal, those areas need to be concentrated. Then after this, take the another sponge cloth, which is this water, and wipe the area. And whenever it is required, we have to, how much we require, that time if the patient is very dirty, frequently we have to clean the patient. If it is required twice, then you need to, twice you have to clean the patient. Then after that we have to make it the patient dry. Now we have to fold the towel and we have to cover the patient with the bath blanket. Then we have to expose the farthest arm. So for the exposing the farthest arm, the bath blanket should be in the middle line, and then we have to put the towel under the patient's leg. Before we go on to the lower extremity, as we finish the upper extremity, we need to change the water. So the waste water needs to be changed. Take the soapy sponge and clean the leg from the ankle to the knee in a long and circulatory. Clean it properly. Then take the sponge cloth, which is for the water, squeeze it out properly and clean the area. And make sure that the under the legs needs to be taken special precautions. Then take the another one, the sponge cloth, take the soap, then clean from the knee to the thigh. Take the cloth, sponge cloth with the plain water and wipe it out the soapy thoroughly. Then now clean the area with the towel properly. Pat it dry. After that, we have to fold the blanket back. As for the same, bring the basin under the patient's leg, dip it into the water and pay attention to the digital legs and areas and wash it thoroughly with soap and water. Or if it's required for the diabetic patient, you have to soak it, the leg for certain 5 to 10 minutes. You need to soak the leg into the water. After that, remove it, then pat it dry. Then make the patient comfortable and cover the leg and expose the nearest leg, and the same procedure which is done from the knee, from the ankle to the knee and from the knee to the thigh, needs to be repeated from the same leg. Now we are going to give the back care. The purpose for giving a back care is we have to assess that whether the patient is not in prone for the bed sore and for the to improve the stimulation for the blood supply of the patient's back. So for that, we have to expose only the required area, that is we have to cover the limbs, that is the upper limb and the lower limb needs to be covered, and we have to expose only the back, that is from the spine to the, from the cervical to the spine, the spinal region only needs to be exposed. So, for this what we have to do, first of all we have to take a sponge cloth, take the soap and rub the area that is in the circular. We have to clean the area that is from the neck to the pelvic region. We have to make it completely clean. Next we have to take the another sponge cloth with the plain water, then we have to clean the area. Then we have to pat it dry. When it is completely dry, we have to take the spirit. We have to take the spirit, pour it in our hand, then apply it to the patient in a long and circular movement. And we have to make sure that we have to apply pressure into the pressure points. Next, when the spirit is dry, we have to take a powder and we have to pat it dry. As it is completely dry, then there are 4 steps for giving the back care. First is the effleurance, second is the paresthesia, then we have the tamponade and the friction. So, first is I will be showing how to give the effleurance. Effleurance is a long and circular stroke. That is with the help of the, we have to make a hand like this, that is the 4 fingers and the thumb should be apart, and to the rib line we have to give a long and circular stroke. This will help to increase the blood supply. The next we have, that is the paresthesia, or we say it as a knitting. Knitting should be given in a small strokes, especially to the skin and to the muscles. Then next we have the tamponade, that is the, we have to bring, but we should make sure that to the rib line we should not make it, and it should be slow. We should not do it very hardly. Then next is the friction, that is a small circular friction. And this procedure, back care, can be done 2 times in a day to promote the blood circulation. And to which patients we are not supposed to give the back care are those patients who are with burns, with the trauma, any chest injury. To those patients we are not, or any rib fracture, to those patients we are not supposed to give the back care. We can take a wet gauze, that we can clean the genital area. After cleaning the genital area, and this needs to be thrown into the paper bag. After this we have to make the patient wear the clothing. Patient should be left comfortable, and the bed blanket needs to be changed with the top linen, and we can record the procedure.